Members, it's the appointed time. We have a quorum. Since the last meeting, the Secretariat has not issued any information paper. Please note that we will have a joint discussion of both items on the agenda today: implementation progress of the residential care services scheme in Guangdong, and implementation progress of the pilot scheme for elderly comprehensive social security assistance recipients to reside in residential care homes in Guangdong. I ask members to refer to CB brackets 11460/2025 brackets 01, 02, 03, and 04 papers provided by the administration and the background briefs prepared by the Legislative Council Secretariat. We have in attendance today some of the officers from the Labor and Welfare Bureau and Social Welfare Department, in particular the Undersecretary for Labor and Welfare. When you're ready, Undersecretary, please brief members on the papers. Thank you. Today, the government is briefing members on the latest progress of the schemes. We have been actively expanding and enhancing the GDRCS scheme to provide one more option of subsidized residential care services for frail elderly persons. And we have announced in the policy address this year, starting from this month, we will have for the scheme 9 more residential care homes for the elderly being covered. They are in Guangzhou, Foshan, Shenzhen, Zhongshan, Zhaoqing, Jiangmen, Zhuhai, and Huizhou. At the end of August of 2025, we have 650 elderly persons admitted to the residential care homes. It is 5-fold the figure in 2022. And we have in the elderly homes providing necessary support for elderly persons in need. The relevant organizations have provided Hong Kong elderly persons residing in the Greater Bay Area support. There are 140 of them, and we can have some administrative work done on the mainland side. We also will have at the end of this year a 2-year pilot scheme to reimburse medical expenses under the National Basic Medical Insurance. So that would be $10,000 renminbi for outpatient services and 30,000 renminbi for inpatient services. We also provide portable cash assistance to elderly recipients. For non-frail elderly persons, even if they want to be admitted to the higher quality residential care homes for the elderly, they can't really afford it with such allowance. So starting from 1st of October this year, we have a community care fund subsidized pilot scheme that is to last for 3 years to subsidize CSSA recipients, elderly recipients, to be admitted to residential care homes under the GDRCS scheme. They can also receive an allowance. So for a healthy singleton elderly who can take care of themselves, they can be disbursed with $9,500 in total, including the $4,500 CSSA, so that they can meet their basic expenditure. We have 1,000 places under the arrangements. The target group is healthy elderly CSSA recipients that can take care of themselves. We have engaged the relevant organization to take forward the relevant arrangements to conduct surveillance and review the effectiveness of the scheme. We are working with the service organization to promote the relevant arrangements. Every 6 months or so, eligible elderly persons can go on a visit to the designated homes so that they can have a better understanding of the homes and select the right option for them. We will have the Social Welfare Department send letters to invite the target group of elderly persons to take part in the visits. We will continue to support elderly persons to retire in Guangdong and facilitate integration into the Greater Bay Area. We welcome members' questions now. All right, we have 8 members having pressed the request to speak button. Mr. Chen Pui-leung, Mr. Andrew Lam, Dr. Aman Yu, Dr. Tick Chi-yun, Mr. Tommy Zhang, Mr. Stanley Ms. Lam So-wai, and Mr. Stanley Lee. We have ample time today, so I'll assign a 5-minute time limit, questions and answers included. Mr. Chen Pui-leung. Thank you, Chair. On the GDRCS scheme, we have seen some enhancement made over the past few years. I appreciate the government's efforts so far. I have some questions that I want to seek clarification on. Starting from October 2023, there is a mechanism put in place where there is a 6-month adjustment period, and if elderly persons cannot adjust to the life in the homes, they can go back to waiting on a place in a home in Hong Kong. So I want to ask how many of them withdrew from the arrangements and had to be put back in the queue for a local place. Next. On paragraph 8. The Social Welfare Department would launch a 2-year pilot arrangement to reimburse medical expenses relevant elderly persons need to bear under the National Basic Medical Insurance Policy, subject to an annual ceiling of 10,000 RMB per person for outpatient services and 30,000 RMB per person for inpatient services. How will the expenses be reimbursed exactly? Will it be passed on to the medical organizations, or is it that elderly persons would have to pay first and they have to apply for reimbursement from the government? Would it be easier if we can have the reimbursement made directly to the elderly persons after their medical expenses have been incurred? Also, we know that for the occupation rates of the homes, there are significant differences. But we have to understand that there are some homes that are only commissioned recently, so there may be a skew in the figures. But for the homes that have been commissioned for some time, we have one that only has an occupation rate of about 50. So we will have more homes under the scheme in future. We will have 24 of them. We will have more places, but we still have a relatively low occupation rate right now. How is the government going to handle this situation? Thank you. Undersecretary, thank you, Mr. Chen Pui-leung, for your questions. I want to answer the third question first. Right now, there are 2 ways for acquiring places of homes. We have the buy place scheme. Basically, the government has purchased the right to use a particular place. So there is the issue with occupation rate. We also have residential care services vouchers. So if an elderly person stayed at the home for a month, we will pay the home for 1 month. And if it's longer, then we'll pay for longer. So with the calculation of occupation rate, it may not be calculated because we won't be paying them if the place is not used. We have local elderly persons being admitted to homes in Guangdong under the relevant scheme. We will not use the highest figure as a denominator for calculations, and that has skewed the occupancy rate because we will not be paying the homes if an elderly person is not admitted to the home. There may be a misunderstanding about how things work. So we do have a maximum number for how many elderly persons can be admitted. So the occupation rate does not take into account how a place is used, and payment is only made then. Sorry, I need to stop you here. I understand what you meant. Some of the places are not paid, but I think with occupancy rates, it shows the popularity of the relevant arrangements. So you may have 100 places, but you only have a 10% occupancy rate. Does that mean the arrangements are not exactly popular with the public? Thank you, Mr. Chen, for your comment. We will continue to publicize the relevant arrangements. We will have the Social Welfare Department and the service organizations take part in this. We will try not to use additional funding for such publicity efforts. We have 20 people withdrew within the 6-month period to answer the members' other question. So they can still have their public housing units if they are currently residing in a public rental housing unit. They will be given a guarantee so that they can take back their own units within the 6-month period. As for reimbursement of medical expenses, we will engage a company and they will announce the details in due course. Basically, the insurance company will see how the medical expenses can be reimbursed. The levels to be reimbursed will be on par with one's fees for paying medical response, one's fees in Hong Kong in relation to medical expenses. Mr. Andrew Lam, we have all along been actively encouraging people to retire in Guangdong. The first issue is with portable cash assistance. It's not just elderly persons. Even their family members don't have a good understanding of the arrangements. And whether it's the mainland in general or in Guangdong, when the elderly persons retire in the mainland, they will have less contact with family members. They may contact their family members via certain online platforms. Well, I just think that we need to think about how we can disseminate information better on our existing platforms so that the information can actually reach the elderly persons and their family members. We have the visits made to the homes every 6 months. So how many visits will there be in the next 3 years? And how many people will benefit? Thank you. Undersecretary, we will involve the Constitutional and Mainland Affairs Bureau in the work to encourage and facilitate the arrangements of elderly persons retiring in Guangdong. We will publicize the relevant arrangements with our different perspectives as well. We have more eligible elderly persons, and we will have some CSSA recipients retiring in Guangdong. We will continue to publicize to them relevant information. We also have such information available at certain units providing services to Hong Kong and Macau residents residing in or retiring in Guangdong. As for visits, we will have approximately 6 visits in the 3 years. We expect homes to publicize their services as well. We therefore expect some private visits to be arranged as well for elderly persons. We welcome any NGOs in arranging for the relevant visits. I understand that for information, the dissemination of information. There are different information platforms, including those of the SAR government and mainland authorities. But with such fragmented information, one can be quite confused. So I hope the government can have a one-stop platform for such information. If you don't have that right now, you should think about what to do. Thank you.
Secretary, or the Secretary, we have appointed the New Home Association Limited as an organization to coordinate the information for dissemination to the senior citizens. Now, for the elderly people not in homes, we do have the hotline, and they can call in to understand what services are available for them. Mr. Frankie Ann, Chairman, I've got two questions. First, the Undersecretary mentioned the experience tour, 6 in 3 years. Has the government tried to ascertain how many of them would be joining, and what considerations did they have after the experience tour? Why is it that they do not choose these kind of care? Second, under the GDRCS, the 3 cities in Chaozhou and Shantou, Chaozhou, Shantou, and Jieyang, they also have RCHEs that are eligible, and there are Hong Kong RCHEs that would be joining with them. So other than the 9 cities in GPA, will the government be incorporating these 3 cities in Chaozhou and Shantou? Will the government be extending this to Fujian and other parts of the mainland? Well, the next experience tour will take place in November, and we will take on board what Mr. An said to gauge the elderly's opinions, and we'll be prepared to share with you. As to Chaozhou and Shantou, we will be focusing our attention on 9 cities in the GPA. We haven't quite covered all of them. If applications are received, we will consider how best we should take this forward. We are confident about Guangdong. Now, we have to make sure that they are rated 4 stars. As to Fujian and Hainan Island, we heard these comments, but they are a little bit far away. I appreciate that there are many people in Hong Kong who are descendants of Fujian and Hainan. Now, we have to consider how best that we can put in place the robust regulation, and we will look at this down the line. Mr. An, now for the 3 cities in Chaoshan, are these organizations that are qualified be allowed to apply? Under Secretary, we will deal with the GBA cities first, the 9 cities in the GBA first. Mr. An, Chaoshan cities are also a part of Guangdong province. If they're interested in making the application, why doesn't the government allow them to make the application? The market will make the choice. If there are people who would like to retire in Chaozhou and Shantou, why do you deny them such a choice? Under Secretary, thanks very much for the comments, Mr. An. It's not simply a question of their preferred location. We have to go to taxpayers' money to visit these RCHEs and to look after them. At the present moment, we are focusing our attention on the GBA cities. For other cities, we will look at them down the line. For Chaoshan, we'll look at them down the line. Under Secretary, perhaps you jot down Mr. An's comments. When we conduct a review of the GDRCS scheme, you might wish to incorporate Chaoshan cities as well. Dr. Tik Chi-yun, Chairman, this GDRCS scheme seems to be developing faster than I thought it would, and the response has been good, and we have built up the momentum. We'd like to incorporate more cities for the senior citizens to retire in. Guangdong does enjoy the advantage. It is more spacious, so there is more manpower, transport, and medical care. There has been a lot of improvement there. So the momentum is really gaining traction. I've got 3 questions. Now, this is an option for the senior citizens. They can retire in Guangdong province. In the mainland, there are many Hong Kong people living there, and they're living in some of the old folks' homes there already. Of course, they can come back to Hong Kong and make an application, but many of them are getting on in years and they need long-term care. This may not be a desirable option for them. For these Hong Kong people who have been living in the homes in the mainland for a prolonged period of time, would there be any voucher scheme to assist in the day-to-day life? Second, about the welfare facilities that are designated in the mainland, we have a lot of comments. To enjoy the welfare, you need to have the habitation period of 60 days and so on. Now, we're encouraging people to retire in the mainland. Would you be relaxing the unnecessary restrictions so that the senior citizens don't have to spend time in Hong Kong and remove all the barriers? I've got a case, a senior citizen who is in the mainland, hospitalized. There is no way he can come back to Hong Kong to fulfill the residency requirement, and there is some medical certificate to show that he's not unfit to travel. Third, we've seen the mainland RCHGs. They're really beautiful. We are concerned about the sustainability there. Now, these services are funded by the Hong Kong government. How can you make sure that the quality of service would be sustainable? Would there be any monitoring or supervision system? Under Secretary, I defer to Mr. Yan for the 3rd question. First off, in the mainland, we are conducting the SCAMO, that is Standardized Care Need Assessment. Now, for 140 senior citizens, we have conducted the SCAMO assessment. They can choose any one of the 24 homes. So we will conduct the in situ assessment there. Of course, it would take a bit of time for us to go through all the homes under the SCAMO. As to the restriction, I must say this again, that the welfare payment, we don't have to make contribution to that. So when we offer this welfare payment, we have to make sure that the senior citizens are connected with Hong Kong. That's the minimum requirement. We cannot allow a situation that the senior citizens would be leaving Hong Kong and still enjoying the welfare benefits. So under the Fujian scheme, or Guangdong scheme, at the beginning of the scheme, we have waived the residency requirement that they have been residing in the mainland, and we have offered the waiver, and there was another waiver during the COVID period. If they retire in the GBA and they cannot provide the residency requirement in Hong Kong, it would be very strange. And they haven't taken part in the scheme in the first place, and now they're saying that they don't have any connection with Hong Kong. It would be very strange. There are some people who are hospitalized in the mainland. The social welfare department look at the medical proof, and it should be okay In some cases, it all depends on the proof that they produced. I'm not going to discuss individual cases here, but the key thing is they must have connection with Hong Kong. If they say that they don't have any ties in Hong Kong and they didn't make the application in the first place, and it doesn't make sense. For the third question, I defer to Ms. Yen. Chairman, thank you. The question is the quality of the service and the guarantee of the quality. Now we have the cooperation agreement whereby the Department of Civil Affairs of Guangdong will be selecting the homes under the list of stars-rated senior care organizations. They must be rated 4 stars, and they must have 2 years of operational experience. For Hong Kong organization to take part over the past 5 years, they must have 2 consecutive years of running subsidized residential care homes with good track record. And we will be monitoring the situation. For mainland homes, we will not be applying Hong Kong rules and regulations. Of course, this may give rise to some concerns, but the fact remains that the rules and regulations in mainland are very sophisticated, and they would monitor and supervise the mainland homes in accordance with the rules and regulations. We have maintained communication channels to make sure that the quality of the GDR CS scheme is up to scratch. So for organizations that are recommended by the Department of Civil Affairs or Hong Kong organizations, they must enter into an agreement. They have to measure up to the standard in the provision of services. So the care and the services must be up to par. And on a regular basis, we would be monitoring the situation. They have to produce the quarterly report and assessment report. We also gauge the views of the users and the family members regarding the satisfaction level. And that's how we monitor the situation. In the service agreement, it would be no more than 3 years. If the services fall below par, there would be other options for us. Dr. Tick? Chairman, I welcome the monitoring system. There are more details and they are more nuanced, and I'm more confident in that. As to the residency requirement, the logic is we're encouraging retirement in the mainland, and there would be more and more disconnected from Hong Kong. And now you say that they have to prove ties with Hong Kong. I don't think we need to engage in a big debate today, but I think we have to put down a marker here. In some special cases, you said you would consider the situation. We're not talking about one single case with special considerations. Would you be offering more views regarding these special considerations so that we can play more of a role as social workers? Under Secretary, Chairman, if I may. Now, these payments are not contributory, unlike other parts of the world. And we have different schemes for senior citizens to become Hong Kong citizens. If they haven't worked in Hong Kong, I mean, if they say that they've been living in the mainland, now they have acquired Hong Kong citizenship, when in fact they have been working in the mainland for many, many years, and they do enjoy the insurance in the mainland. And if they want to use Hong Kong's welfare benefits, we have to really ascertain whether they are eligible. Now, if they do enjoy the waiver in the first place, then it would be okay. But if they never applied for waiver before and all of a sudden they're applying for the waiver, we have to ascertain their ties with Hong Kong, how they can establish the connection with Hong Kong. I fully appreciate the social workers' desire to help the senior citizens, but we have to make sure that the taxpayers' money is used judiciously. If they have made contribution, then that's fine. But this is non-contributory payment. We have to make sure that the taxpayers' money is used judiciously. We have to hold fast to this principle.
局長，
Mr. Tommy Zheng, I have some questions for the Undersecretary. I do support the government's work in this regard, but I remember 10 odd years ago there was a private home in Shenzhen. I think it was operated by a healthcare practitioner. It was actually located in Guangzhou, but it's close to Shenzhen. It had an higher occupation rate, but they are not willing to cover this home in the relevant arrangements. Look, this is not the point, but I was part of the operations of private home or private homes for a while, and I note that when elderly persons have to stay in homes locally, the environment will not be as great as the environment in the mainland, but they don't want to go to the mainland because they want their family members to visit them. So with homes being in the Greater Bay Area, can you provide some sort of services to take elderly persons back to Hong Kong to see their family members? Maybe we can have a coach that can convey them to Hong Kong regularly. If not, can we provide some sort of facilitation to their family members to visit the elderly persons in the Greater Bay Area? I think you need to provide some convenience to elderly persons in meeting with their family members. That will greatly help encourage them to retire in Guangdong. But I would say, look, local services are not bad, but there's just simply not enough manpower. If we want to encourage elderly persons to receive elderly care in Guangdong, we need to provide some sort of middle ground where we can facilitate them in meeting with their family members, or maybe they can meet in, say, Lowu or Shenzhen for meals. Thank you. Undersecretary, I think Mr. Tommy Zheng was referring to a Shenzhen Yantian home and another home in Zhaoqing, and these homes were participating in the relevant arrangements early on. We do see now for the 24 homes under the arrangements, they are closer to Hong Kong, or they have easy access to Hong Kong. Some of them are indeed located in the hometowns of many elderly persons, which is why we focus on the Greater Bay Area homes first. As for how we can facilitate visits made to elderly persons by family members, we attach great importance to providing such support. We have engaged an NGO to provide relevant services. I'll perhaps ask my colleague to supplement such information. Thank you, Mr. Cheng, for your questions. In accordance with regulations in the mainland, there have to be family members or carers accompanying the elderly persons when elderly persons are admitted to homes, and there should be regular visits made by family members. With the New Home Association support services, we have the association making use of their social media so that there will be groups that facilitate contact between elderly persons and their family members. The support services of the New Home Association works in the sense that they have been trying to facilitate contact between elderly persons and their family members. And with elderly persons choosing to retire in Guangdong, they have made such choices voluntarily. They do understand it does not take much of a commute for their family members to get to the relevant places. It only takes about an hour or so. So if elderly persons have been arranged to be admitted to homes in the Greater Bay Area, the family members will still visit them. Well, I would say according to the paper, you are only facilitating remote visits, perhaps online meetings. But elderly persons like me, the older generation, wants to have face-to-face contact, and we want to have meals together and talk over meals. So with elderly persons having been admitted to homes, we want them to be happy. We don't just want them to have a place to stay in. I think you can be more user-friendly, be more incentivizing rather than being, in a way, punitive. You have to get out of that mindset. I have something to add, Chair. Thank you, Mr. Chung, for your comments. We'll see if homes can provide more support services. But I understand that some homes have some facilities that would encourage family members to stay in such facilities, such as the home Mr. Tommy Zhang mentioned. And there is another home very close to the Guangzhou South Station that has such facilities in their villa. So I believe homes can provide different facilities to attract more elderly persons to stay at their homes. Thank you. Mr. Stanley, I really appreciate the progress of the GDRCS scheme. There are more favorable conditions that would encourage elderly persons to retire in the mainland. But it seems that some elderly persons still have some reservations. There are 24 homes under the relevant scheme. How many places are there for these 24 homes in total? According to Undersecretary, right now 650 elderly persons were admitted to homes in the mainland. Does the Bureau have a target for how many elderly persons should be admitted to homes in the mainland to better utilize the elderly care resources in the mainland? I believe there is a trend of people retiring in the mainland, but we need to make sure our services are up to par to provide high quality services to elderly persons. I also want to ask about regulation. For elderly persons having been admitted to homes in the mainland with admission, that's not the end of it. It's not just providing them with a place. We need to ensure the quality is up to par and the homes are complying with the relevant requirements. There should be regular reviews, or we should at least gauge feedback of the elderly persons and their family members. I also want to ask, will there be proactive inspections conducted on the homes? I also want to ask about medical support. For those admitted to hospital, if a surgery has to be undertaken, it can cost a lot. And if you have to have elderly persons seek reimbursement from an insurance company, it is very inconvenient. And as I said, the services and treatments can cost a lot, say tens of thousands of dollars, and an elderly person may not be able to pay that upfront. How can we better support elderly persons in this regard? Undersecretary, thank you, Mr. For your questions. With the numbers, the figures, they can be adjusted. These are numbers pledged by the homes. So if, say, a floor of a particular home is fully occupied, they can assign 2 more floors for the services to be provided under the scheme. Excuse me, I'm asking how many are there at the moment? We have pledged the maximum number of places to be 2,000 odd. But this is not a figure relating to occupancy rate, because this is something that is non-accountable. The payment is only made when an elderly person stays at a particular place. As for inspections, I will let my colleagues supplement such information, but basically we will conduct the inspections. New Home Association will also conduct some inspections. What was the third question again? Oh, right, the third question was about medical expenses. I understand where Mr. Was coming from, but there is already a reimbursement mechanism in the mainland. So in total, one can reimburse about 60 to 80% of the medical expenses with reimbursement arrangements. If we have to fully reimburse the expenses, it is going to make things quite complex, and the mainland authorities are reluctant to really take this forward in this manner. We do understand that elderly persons would want to have everything settled on that occasion. We'll see how enhancements can be made in future upon reviews. I'll now let my colleague supplement information in the relevant areas. We will make sure homes provide a specific level of quality of services with reference to service agreements. We will conduct an inspection when a home first joined the relevant arrangements. We will review the relevant services provided to see if the level of personal care provided to elderly persons is on par, whether they are keeping the required records, what the elderly persons and family members think about the services, their manpower. So we will review various areas. We also maintain contact with the elderly persons and their family members to gauge the standard of care provided by the organizations. We also talked about New Home Association services earlier, and regular inspections will be made by the association within the 6-month adjustment period of the elderly person to see if the elderly person is adapting well. Sometimes an elderly person is not adapting well, may not have something to do with them but with the home. So New Home Association will maintain contact with the homes as well. And if there are any complaints can be made to the homes or social welfare department or New Home Association, and New Home Association can play a coordinator role. Mr. Sunley asked earlier about reimbursement arrangements. What with elderly persons having to pay first, and payment can be made electronically. Chair, we will first go with the arrangements in the mainland, so elderly persons will have to pay a certain amount first. We'll see in future if there are other arrangements, because it would involve some changes in the system. We need to liaise with the relevant authorities before we can think about adjusting the arrangements. Thank you.
Mr. Stanning, any follow-up? Chairman, the senior citizens don't have this kind of money to pay upfront. That's the key issue. Since ultimately you're going to be offering the subsidy, why don't you make things simpler for the old folks so that they don't find themselves in a desperate situation? In Hong Kong, some of them may enjoy some support, but they don't have this kind of money that they can come up with easily. Under Secretary, we'll have to liaise with the mainland authorities about this payment upon discharge from hospital. It would be hard for them to not pay upon discharge. It would involve the change of the system, and the senior citizens will have to front up the payment for reimbursement. It would involve a change of the system if the senior citizens don't have to pay anything upon discharge. And I think it would take more efforts. We implement the system first. As to how we can fine-tune the system, we will be prepared to do so. That would be for the next round of discussion. Ms. Connie Lam, Chairman, this residential care services scheme in Guangdong was first introduced in 2014. It's been a decade or so now. Now, in this pilot scheme, many of the senior citizens are not frail citizens, and they also went to the mainland to spend their retirement years. The one in Shenzhen, Yantian, there are some senior citizens from Hong Kong. The number is pretty significant. And for frail senior citizens, we do have a lot of publicity, but for the healthy citizens, they don't have any publicity. And they don't know how long they can leave Hong Kong without losing their eligibility for security payment. I've got approached by some senior citizens, some healthy senior citizens chose to spend their retirement in the mainland out of pocket. That they're approaching 70. When they come back to Hong Kong, they didn't realize that if they don't spend in Hong Kong for 90 days, they wouldn't be entitled to the old age allowance. So there was a lack of publicity in this regard, and there are such a group of senior citizens who find themselves in a tricky situation. Now, many elderly citizens are retiring in the mainland. In the GPA, they have to take out an insurance. There may be a dozen or so in different homes. Some of them are not subsidized by Hong Kong government. How many of them are actually retiring in the mainland? Second, about the frail senior citizens. Now, there is this scheme for the elderly CSSA recipients who reside in RCHGs in Guangdong, and there is the subsidy amount raised to $9,000. Now, if you take into account inflation and the higher level of care that they need, would there be any possibility of the subsidy amount being adjusted? That they join the scheme and they've passed the trial period and they find that they're not happy with the service, the quality of service, and have arguments with the neighbors. Will there be any mechanism for them to switch homes for the old folks? I mean, they may be spending the rest of their twilight years there until the very last day. And would there be any mechanism for them to change the homes in Hong Kong if you're living or residing in a nursing home? Unless in special circumstances, it would be hard for the senior citizens to change their nursing homes. What about in the mainland, in Guangdong? Why, leave the third question to Madam Yan. Now, for the subsidy amount, the $5,000, and the $5,000 will not be adjusted, but the CSSA payment will be adjusted. Ms. Lam talked about the senior citizens who retired in mainland, but they never applied for any welfare payment, and they like to reapply for the welfare payment to enjoy the benefits. As we said, there were 2 rounds of waiver. The first round was during the beginning of the Guangdong scheme and the Fujian scheme, and it was a waiver that they were open for application. They've been there. There is no justification for them to come back to make the application. The second round of waiver happened during the epidemic. If they missed out on these 2 waivers, and if they missed out, they may be missing out on these waivers for some reason, or in some other cases that they have acquired Hong Kong citizenship and they went back to the mainland. So we would ascertain why they failed to establish a connection with Hong Kong while they are living in the mainland. Now, this payment system is a non-contributory system. We have to make sure that we would offer the payment to those with ties with Hong Kong. So quite inevitably, this is a choice that we have to make. It is on this basis that we make the arrangement. For individual cases, I hope that Ms. Lam would refer them to the SWD. For the third question, I hand you over to Ms. Jenny Yan, AD. Now, there are 2 questions there, and I heard that for the CSSA recipients, they are in the Guangdong scheme. That they are not frail, elderly, and they haven't gone through the SCAMO assessment. Now, for the frail, elderly, joining the GDRCS scheme, can they change the homes? Ms. Lam is very familiar with this. Now, for subsidized residential homes, it would be difficult. But for the mainland, each home would reserve some quota for Hong Kong elderly. But they do have more flexibility. They have more places. In 2024, we have increased the number from 15 to 24, and there are enough places available. Indeed, there are many elderly people for some adjustment reason have applied for a change of the homes. As the Undersecretary said, it would be more like the voucher scheme, whereby the money would follow the people. Where possible, we would make the arrangement. Mr. Stanley Lee, Chairman. retirement across the boundary. It was a motion that I raised and that was carried in the council. And with regard to this scheme, I'm grateful to the administration for increasing the number of participating homes. The motion that I referred to during the research process, I've interviewed about 1,000 local senior citizens. 50% of them retired in the mainland. Their consideration is mainly the medical issue, and they are very concerned about the medical care across the boundary. So today, we are discussing this particular scheme. We are taking stock of this scheme. I think we have to step into the shoe of the senior citizens in Hong Kong before we will be able to offer the services to them in a proper manner, and that's only the right way to go. And I think departments like the SWD should understand their concerns about the medical care in the mainland. And for the homes taking part in this scheme, the mainland homes, have they got the green channel with the neighboring hospitals? Are they able to meet the needs of the Hong Kong elderly who may have medical care needs? And also, why do we have to make the elderly pay the fee up front? They don't have a lot of savings. And with regard to the healthcare voucher, we have been saying that the senior citizens don't have to be made to pay any money up front. So I think the government can put some money into a pool in the mainland so that the elderly people who are eligible will be able to get money deducted off the pool. If they have the money ready and waiting for deduction, they would certainly be more prepared to accept it. But if you don't do this, they may not be, they can't be bothered. I think we have to make sure that make sure that things are mutually beneficial. Well, the other thing is publicity. How many elderly people will be going on the web to look for details about this program? Before this program, we only had the homes in Yantian and Zhaoqing. I think things have moved on. At the time when the senior citizens undergoing the scheme assessment, they didn't have any choices in the mainland. And we said that they should be made aware of this particular option. Now we have optimized and enhanced the scheme. We have to make sure that there is an option open to them, and the medical care available would be able to be on par with that in Hong Kong. And I think we have to make sure that they don't have to shell out the money up front. I think we have to be more proactive. We are not dragging the senior citizens kicking and screaming to the mainland. We're offering an added choice to them. If this option is going to be standing them in good stead, why do we not do more? Why don't we do more publicity in the daycare centers for the elderly? It's entirely up to them to exercise the choice, but at least they should be given as much information as possible regarding this particular scheme. Under Secretary, Chairman, by way of clarification, now, the medical expenses for these senior citizens, it would be operated in the same way as the locals in the mainland. Mr. Chen Pui-leung may be more familiar with this. That mainland people, they have the medical insurance, and the money would be deducted off the insurance. And for the money that they have to pay to be paid for themselves, they have to make the payment. This is how the system works in the mainland. For Hong Kong elderly people, they have to follow the same procedure that we would be applying for their residency in the mainland, and they have to take out the urban customized commercial medical insurance, and we would also take out the insurance for them. And there's a cheaper form of insurance. There's a top-up insurance. And with these two insurance packages, the expenses that have to be paid for would be different in the mainland. In Hong Kong, everything is free, more or less. But in the mainland, they have to make the payment, and the payment can be reimbursable afterwards.
Excuse me, Chair. You are talking about them paying first and then they will be reimbursed. But then also Shenzhen, people in Shenzhen, do they need to make contributions to urban and rural resident medical insurance? No, which is why there's no prepayment. What I'm referring to is elderly persons having to pay first and then they will be reimbursed later. Yes, they have to pay when they are discharged from hospital. And what's better for Hong Kong residents is that the government of Hong Kong will be paying some of the medical expenses of elderly persons incurred for such services. If we need to have elderly persons not having to pay upfront at all, we actually discussed this option with the relevant authorities in the mainland. It is quite hard because it has to change their system. We do keep an open mind in making adjustments in future, but let me emphasize that the mainland authorities have reservations, and the operations work exactly the same for mainland residents and Hong Kong residents at the moment, and we are reimbursing an additional portion of the expenses for Hong Kong people, but they need to pay after they have got relevant treatment and services. They do not need to pay before the treatment and services. That's what I would like to clarify. For the 10,000 outpatient services, on top of that, elderly persons will still have entitlement to the vouchers available to them at the moment. On publicity, we have been advocating in different elderly centers such information. We have also plans to arrange visits to the relevant homes, the experience tours. In my understanding, when the GDRCS launch, under SC names, one can select options under the GDRCS scheme. The arrangements were not as popular as they are now because there was no high-speed rail. Now they do. I hope the Undersecretary will understand what I'm saying. Chair, I'm sure you know he probably does not understand what I'm saying. Let me try to summarize how it works. So there is a portion where the handling is done by the relevant unit in the mainland. I believe there was internal communication that it would take some time to make some changes to the system because there is an existing system in the mainland. For certain people who have work and the office has issued a particular card to them, they can just use that card so that they don't have to pay up front. Member, please understand that there are different authorities and there are different settlement systems in different cities. I think you need to give the Bureau some time. I think the Undersecretary understood what you said. Chair, I just want to say something. If elderly persons have to pay upfront, it is not very appealing for elderly persons, and the scheme cannot be regarded as effective. I understand what you're saying, the Bureau can review the relevant comments. Thank you. Dr. Tan Yueheng. We have put in place a mechanism under the scheme, a 6-month adjustment period. We have 650 people being served under the scheme at the moment. I believe some of them would include those who are in their 6-month adjustment period, and there are some who have gone beyond that period and are still staying in the homes in the mainland. This scheme has been in operation for about 2 years. So how many of them withdrew from the relevant arrangements within the 6-month period? Have you conducted analyses on what the reasons were? Did they have problems with healthcare? Did they have problems with social life? Maybe they couldn't adjust to the environment. If we tackle the relevant problems, we will be able to encourage more elderly persons to retire in the mainland. Starting this month, we have 9 other homes covered under the scheme. Before, there were only 15. With the 9 additional homes, we have 24 homes under the scheme. As I said earlier, we have 600 odd elderly persons admitted to homes in the mainland. We have seen in terms of supply that is a significant increase from 15 to 24. Has the government engaged with the 9 additional homes, 24 in total, in the next 3 years? How much of an increase will we see in occupancy rate so that there is a balance between demand and supply? Thank you. Chair. Thank you, member, for your questions. We actually talked about this earlier. We had 20 elderly persons withdrawing from the arrangements, perhaps due to deteriorating health or adjustment problems, and they will either be taken care of by their family members or they will be admitted to a local home. As for the number of places of homes in the mainland, the cap is at 2,000 odd. If a particular home is especially popular and the occupancy rate has reached almost full occupancy rate, we can discuss with the home to see if they can expand their capacity some more. As for the occupancy rate, it does not take into account the maximum, or does not take into account the actual numbers, because it takes into account the maximum numbers, so the figures may be skewed. Thank you. Mr. Chao Siu-chung, I am concerned about payment for medical expenses by elderly persons in the mainland, specifically about the payment arrangements. We actually raised at a meeting of the panel earlier before some elderly persons' concerns in this regard. We have relayed such concerns. I have recently visited the mainland to visit a relative who was admitted to hospital in the mainland. I could see that the mainland hospitals have been quite accommodating. They would still perform treatments and services or resuscitation treatments should the patients need such, even without payment. But it's not that when one is discharged from the hospital that one would have to pay often. In the middle of services being provided, the hospitals would have already asked the elderly person's family members to pay 20 to 30% of the medical expenses, maybe like 30,000 renminbi. And the medical costs may increase as more treatments and services are provided. But when one is admitted to hospital due to some sort of acute illness, they do not have their families with them. They can't pay. So I don't think the Undersecretary has to repeat himself. I know it is definitely difficult if you are talking with a specific bureau for Social Security, but can you talk to the homes so that payment can be paid out of the homes, so that when the staff members of the homes take elderly persons to hospitals, the homes can pay on behalf of the elderly persons. And if it goes up, exceeds the payment made by the government to the home, then the government can compensate for the home for that, or we can have later reimbursement to be made by family members of the elderly persons. We are often concerned when elderly persons, they do not have the support of their family members. They cannot pay. And often these elderly persons would have been means tested anyway. Why can't the government do more for them? We have about 8,000 odd RMB in allowance under the relevant arrangements, but then for the better homes, it would have already cost, say, $9,000. The money is quite tight. The Undersecretary mentioned that CSSA would be adjusted with reference to inflation. So will you have a mechanism to review the fees of the homes and other services so as to adjust the relevant allowance to better support elderly persons under the scheme? Thank you, Chair. Undersecretary, thank you. We have yet to officially launch the pilot scheme for elderly recipients of CSSA. We will conduct reviews in due course. But for the target group under this scheme, we expect these elderly persons to be healthy and capable of taking care of themselves. If they think with the allowance they can't really survive in the mainland, they will need to think about whether staying in the mainland is the right option for them. Maybe they should stay here. We will make adjustments if necessary. We will conduct a review in the middle or late in the implementation of the scheme. We do thank Mr. Chao Siu-chung for his suggestion. As for whether we can communicate with homes directly, we would need contact information to be provided to the homes on the family members of the elderly persons. If there is no relative, the homes will be dealing with the matters relating to the elderly persons. With reimbursement, it's not just about medical expenses that is for services provided by hospitals. It also provides for drugs outside the formulary. We need to carefully consider what components the reimbursement can cover. If the government has to pay something outside of the existing scope, there may be some issues stemming from this. So we need to carefully consider the different options. Thank you, Ms. Judy Chen. I thank the Bureau for doing much in the area, but there's always room for improvement. For the pilot scheme, according to the third paragraph, the target group, it's paragraph 4. The target group are elderly CSSA recipients who are relatively healthy and capable of self-care. And you have some figures for singleton and doubleton elderly CSSA recipients who are relatively healthy and capable of self-care and living in non-subsidized residential care places or private rental housing. There are 5,700 of them. How many of them are living in subdivided units? Do you have the relevant figures? The basic housing units bill will come into operation next March. And I know the operations of the bill will affect quite a number of SDU tenants. The Housing Bureau has deployed resources in publicity. Can we rationalize the allocation of resources so you can work with the Housing Bureau to provide such information to elderly persons? Thank you.
Assistant Director Ma. Thank you very much, Madam Chen, for the question. In the paper, we mentioned 5,700 people. That's on the basis of the CSSA recipients. And we are talking about the relatively healthy people capable of self-care. And they are mostly living in the non-subsidized care homes or the private buildings that are taking part in this trial scheme. That's why we have the number of 5,700. But for those who are living in the private buildings, how many of them are living in subdivided units? We don't have this kind of breakdown here. However, through this scheme, the eligible elderly people will have an additional choice to retire in the mainland. This is one of the objectives of this scheme. For those who are living in the subdivided units, if they have any need for welfare or any other services, we do have other schemes to help them. Ms. Chen, would you be promoting this across different bureaus? If they are getting in touch with these singleton elderly or doubleton elderly, you can do this across different bureaus so as not to duplicate effort. Under Secretary, yes, we will be liaising with the Housing Bureau, and definitely we'll work together. If they want to do publicity about leaving the subdivided units, we will work with them and offer these solution to them as well. Ms. Lilian Kwok. Chairman, thank you. Sorry, I just stepped out for a while. I'd like to ask some questions about the GDRCS scheme. Now, I'm glad to see that the CSSA recipients will also benefit from them. But if I may ask another question here about the accounts. Now, some of them are using the healthcare voucher scheme, and if they pay for the services using the healthcare voucher scheme, this may not be acceptable in the mainland system, and the elderly people will have to shell out money up front. And if they have insurance, then they can claim the reimbursement from the insurance companies. I'm trying to think about this. Is there any way we can help these senior folks in a way that the payment would be simpler? In Taiwan, for instance, if they are living in the mainland at the grade 3A hospitals, the bill can be passed on to the Taiwan authorities for payment, and the elderly people don't have to make any payments at all. So I'm trying to think if or in that kind of situation, would there be any more straightforward arrangement that there may be some small amount that the elderly will have to pay, and under the healthcare voucher scheme, you can have a separate account, an account tied to the government and another account tied to the insurance companies. So this is something technical, and I'd like to make this suggestion for consideration by the administration. Second, these elderly people, they are residing in the mainland, and some other members also expressed similar concerns. Perhaps we can offer them more support for the family members to meet with the elderly. Would there be any ancillary hostels for the family members? Would you consider this idea? Like the hostels in the city scheme, would there be any hostels in the vicinity of the homes for the sake of the family members? And there may be children who would like to visit their parents, and they have to live in the hotel, and the hotel may be some way away, and they have to commute back and forth. In many other parts of the world, they have similar arrangement. In Fujian, there are some large RCHEs whereby they have another block specifically for the family members. So in future development, in Shenzhen, for instance, would there be any link established with the hotels nearby to provide the facilities? Undersecretary, you have addressed this question. You might wish to reply again. Yes, I defer to Ms. Yan regarding the family members. Now, for the medical expenses, as we said, when payment is made, the insurance would offset the amount. What we are talking about is the amount borne by the elderly people. In Hong Kong, elderly people enjoy completely free medical care. Now, we are talking about this amount borne by the patient, and they have to make the payment, and then they can seek a reimbursement. For outpatient, it is 10,000 RMB. For inpatient services, it is 30,000 RMB. Healthcare voucher scheme, it is a different matter altogether. But for outpatient and inpatient services, we'll see how we can liaise with the NHSA to streamline the arrangement. But at the present moment, the arrangement would be exactly the same as the local people. In Hong Kong, we would pick up the amount borne by the elderly people as well. But we'll try to see how this can be simplified. Ms. Kwok? Chairman, if I may respond quickly to the Undersecretary. I mentioned the healthcare voucher scheme. Perhaps we can have another platform set up. The amount can be moved over to the healthcare voucher scheme, whereby the entire payment can be addressed. It would be a lot simpler, but for the government, you may need to do more to fine-tune or upgrade the platform. It may involve different departments or bureaus, but I'm just looking at this from the perspective of an average citizen. Yes, Ms. Yen? Thank you very much, Madam Kwok. That the GDRCS scheme, when we pick the homes, we would pick the homes on the basis of the level of care for the senior citizens. In the mainland, the homes are more spacious, and they do have some room dedicated exclusively to the family members visiting their elders. It may not necessarily be an entire block, but for Yantian or Zhaotin, homes that they do have the facilities available, but for other homes that they may not have in a separate block, but they do have the facilities available for the visiting family members, so that it would be a lot more convenient for them. There are many homes that are really readily accessible, and the family members may seek accommodation somewhere nearby. As I said, they have more space, and the canteen would be like a restaurant. And during the festive seasons, they can book the tables, they can book the whole set of meals for them to share together. This is available in the mainland, and we will pay attention to these facilities. Ms. Kwok, if I may respond here, Chairman, I understand what you said, to encouraging this to happen in the mainland. But I'm wondering whether when they seek cooperation with the Hong Kong SAR government, would you consider making this a condition whereby you would be awarding a higher score for them? Shenzhen may be readily accessible, but there can be some cooperation with the hotels nearby to facilitate the family members visiting their elders. Right? You take note of this comment, and I'm sure you might wish to consider that. For the second round, Mr. Stanley, 4 minutes for the Q&A, please. Stanley, Chairman, thank you very much for the opportunity. I'd like to follow up on 2 issues. We mentioned the medical expenses. Now, for the elderly people, those who joined and gave up and came back to Hong Kong, many of them did so because of the medical issue. And they find it difficult to meet the medical expenses, and they have no choice but to come back to reside in Hong Kong. Now, the administration has the ceiling of subsidy up to 30,000 RMB. And this is the money available for them. I hope that you will make things simpler, remove the barrier, make things a lot more straightforward for the senior citizens, so that if they if they are hospitalized, they're under the knife, they don't have to be worried about anything at all. Now, we are buying these places from the mainland, which is in the form of a voucher scheme. I understand that in the mainland, many of the homes are offering a checklist for people to choose from. And some elderly people may have special needs. Would we consider on the basis of this voucher scheme, allow the elderly people to pick and choose the kind of services that they desire out of their own pocket? Would that be a flexible arrangement that would be considered? Would there be any top-up, Under Secretary? Thank you very much, Chairman. Thank you, Mr. Ng, for the comments. First, about the medical expenses. Yes, the advance of the medical expenses. And the second one is about the top-up. Indeed, the practice is on par with that in Hong Kong. We are buying these services for the elderly people waiting for the subsidized residential care places. And if they want to top up the money for more services, I think this is possible. Some would be topping up the money to such an extent that they would have individual single room. Ms. Yan, Chairman, For senior citizens taking part in the GDRCS scheme, they don't have to pay the fees that would include the board and lodging, the food, the rehab services, and so on. All the basic care would be available, but indeed there would be some top-up services, and the elderly people would be picking and choosing the kind of services that they desire, like acupuncture or some other rehabilitation services. They can shell out more money. There is a checklist for them to take their picks. Maybe they would like to have a single room, or they like to switch to other rooms. This is also possible under the scheme. Depending on the needs and depending on their affordability, they can pick and choose the kind of services.
Right. I believe some homes representatives said restrictions are imposed on them by the government. Why is that? I think it is only recently such restrictions are imposed. Chair, the government can allow services that are ordinarily provided in Hong Kong if there are additional services, but the elderly persons can pay for them. It's all right, but if you're asking the government to accommodate the additional services better than what is available in Hong Kong ordinarily, we can't do that. Thank you, Chair. Any other business? There is no any other business. This is the last meeting in the 2025 session. I would like to take this opportunity to thank the Secretariat and the administration for your support. The report of the panel will be submitted at the LegCo meeting on 15th of October. If there's no other business, meeting adjourned. Thank you.